This video is going to cover public health, science, politics, and prevention in Chapter 1 of your public health textbook, Introduction to Public Health by Mary Jane Schneider. This video is based on the 5th edition of the book. What is public health? C.E.A. Winslow provided the definition of public health in 1920, and that definition is still valid today. That definition is that public health is the science and art of preventing disease, prolonging life, and promoting physical and mental health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, the education of the individual in principles of personal hygiene, the organization of medical and nursing services for the early diagnosis and preventative treatment of diseases, and the development of the social machinery which will ensure to every individual in the community a standard of living adequate for the maintenance of health. That is Winslow's definition of public health. The Institute of Medicine also provides a good understanding and in terms when we're thinking about public health. So their future of public health, a refocused attention back to public health and in hopes of revitalizing the field of public health. I think today, as we are going through this pandemic of COVID-19, now we're really understanding what the need is to revitalize public health. There was a time in our earlier history where we were, as a society, plagued. Mortality and morbidity rates due to disease and infection had rocketed. Some of the fevers and plagues of those times would devastate populations. And so, as medicine has advanced over many decades, the centuries even, the thought of public health has not received as much attention because we have been able to keep public health crises managed and minimized due to modern medicine. That's technological advancements, medicine, research and knowledge about healthcare, genes, we have a better understanding of why people get ill today, and so we're able to cut down. Again, also advances in medicine such as big farm, as we like to call it. We're able to keep with antibiotics, we're able to keep a lot of infections. Vaccines, we're able to keep a lot of what we prior illnesses in the past that would devastate population down to a minimum. But the Institute of Medicine had thought to revitalize the field of public health. And even though there was not a lot of buy-in to this, I think now with this pandemic and the fear of future pandemics, you may see a lot of funding in the future toward public health. But the mission, according to the Institute of Medicine, the mission of public health is the fulfillment of society's interest in assuring the conditions in which people can be healthy. So again, the mission of public health is the fulfillment of society's interest in ensuring the conditions in which people can be healthy. It's also the substance is organized community efforts aimed at the prevention of disease and the promotion of health. Again, organized community efforts aimed at the prevention of disease and the promotion of health. As we talk about some of the different public health issues and crises throughout the course and throughout the semester, I want you to always think about the fulfillment of society's interest in assuring the conditions in which people can be healthy. What are the specific interests that society has in making sure that the conditions that people are living in communities, neighborhoods, in certain different geographical regions, how can they be healthy? When we're again talking about tobacco, obesity, what are those conditions to help people stay healthy when they're dealing with chronic health conditions as well as when they're dealing with pandemics such as COVID-19? Think about your understanding of the efforts that go into communities or organized efforts that you see that goes on in communities that are aimed specifically to the prevention of disease and the promotion of health. For an example, one of the assignments for this course is a public service announcement. One of the, or we also call it a PSA. When you think about a public service announcement, that's considered a effort aimed at prevention of a disease or a promotion of health and or promotion of health, excuse me. So that's one assignment that you have specifically in this course that will help engage you in further understanding and what is required to push forth an effort. It's a social media campaign effort for this particular assignment that we have, but that is considered a public health strategy. So not only for COVID-19, but I do want you to think about public health more broadly. And when we cover different chronic conditions, I want you to think in depth about what are some of the efforts that you are aware of. And then I also want to challenge you to do some research and think about other efforts, community public health efforts that you may not be familiar with that happens routinely related to a given illness or condition. As stated, our core functions of public health are assessment, policy development, and assurance. So the core functions of public health again are assessment, policy development, and assurance. I'm not going to go into too much detail because that was reviewed in a prior video. Public health versus medical care. Oh, excuse me. Let me go back. Also, you should have read over these functions in-depthly in your textbook. Public health versus medical care. In medicine, the patient is the individual, right? So when you think about medical care, the patient is individual. In public health, the patient is the community. Another way to think about it is when you think about medical care, oftentimes that's occurring at the micro level. And when you're thinking about public health, it's happening more at the meso and the macro level. Public health diagnoses the health of the community using public health science. So again, because public health is focused on the health of the community or a geographic region or a state, larger areas, larger population, public health science, we use health sciences to understand that diagnosis of health. When we think about how a given health condition may impact a larger area, we use health sciences to do that. Treatment of a community involves new policies and interventions. So again, we're using health sciences to diagnose what is happening in a given region, but we are improving health outcome and interventions using policies and policies that affect a broad population of people. And we're thinking about interventions. We're also thinking about how to treat a disease, how to treat a public health issue. It could be environmental as well. From a broad standpoint, how to impact numerous people to improve outcomes. The goal of medicine is to cure. The goal of public health is to prevent disease and disability. Again, on a more micro level, the goal of medicine and medical care is to cure. In reverse, the goal of public health is to prevent disease and disability. And even when we talk about preventing disease, public health is also involved with preventing um, um, preventing the exacerbation of a disease. So we want to make sure that even if we can't prevent somebody from having the disease, we want to make sure that we prevent the disease from worsening over time with the population. So prevention of disease means preventing the disease from ever happening if possible, but also preventing the progression of the disease as well in a community or in a population. Only 3% of the nation's total health spending is spent on public health. Um, we do know that life expectancies of Americans, particularly, have increased over 30 years. Um, have increased by 30 years over the 20th century. but only 5 of those years were attributed to modern medicine, and that's saying a lot. We hear a lot about how we've advanced as a technology in terms of modern medicine, but when we're thinking about in the last 20 years, we have been able to impact um, life expectancy. And to say that we are at a point from our earlier history in the United States where people are living 30 years longer is definitely something to be happy about. It is something to be in awe about, but not so much when it comes to public health. To only be able to attribute 5 years of those 30 years of added life expectancy to public health, that really makes it clear that there's a lot more that we need to do in terms of public health, in terms of funneling more resources to evolve as quickly in terms of our interventions to help impact population health and communities. Science is how we understand threats to health, determine what interventions might work, and evaluate whether the intervention has worked or evaluation. So we use science to understand threats, risks, risk factors to health. We also use science to help us understand what interventions are most effective, what we call evidence based, in terms of being able to have the outcomes that we can predict and consistent, valid, reliable outcomes related to intervention. But we also use science to evaluate whether the intervention actually has worked as well. So we're oftentimes using um, scientific principles in our evaluation process. Politics, in reverse, is how we as a society make decisions about what policies to implement. So, again, when we're thinking about public health, you're always considering science and politics. I'm sure you have seen probably very clearly with COVID-19 how politics and public health has played a role. You have, depending on your values and beliefs, your political values and political beliefs may may influence how you view COVID-19, how you look at how to assess and diagnose and test for COVID-19. Your values and beliefs will indicate the policies and interventions for that. Similarly, your values and beliefs, political values and beliefs, will also determine what interventions you think are best, um, what policies you feel may be best for a given population. And similarly, your values and beliefs, politically speaking, may also influence how you evaluate intervention as well. But there is a difference between science and politics. And oftentimes you will see science and politics aren't always on the same page, and science and politics don't always agree. Again, I think you can see very clearly in this political climate where there is friction, tension, pressure between science and politics. We've seen our leaders, um, um, put interventions and policies in place um, that influence how science is able to obtain information, share information, and so forth. We can talk more about that at a later date. But again, just understand that there is a divide between science and politics. Um, Politics is how we as a society make decisions about what policies to implement. Politics is part of both the policy development and assurance functions of public health. So when you think about politics, right? Politics are directly aligned with how policy is developed. And this shouldn't be surprising in that when you think about your political values and beliefs, they will find their way, those values and beliefs will find their way into the policies and development. How you're seeing public health issues, how you're viewing them, how you're understanding them, and how your values come to play with them will again determine how your policy is developed. And again, the assurance functions of public health will also find is also aligned in the politics as well. Community pays for public health initiatives through taxes. And so again, you can understand how politics are involved in public health. A lot of the funding that goes into public health, a lot of funding in a lot of areas, but particularly for public health, can be seen in politics and the decision making process. Public health disciplines to consider is epidemiology. We talked about that in another video. Statistics, biomedical science, environmental health science, social and behavioral science, health policy and management. Again, when you're thinking about the uh, disciplines that fall under public health, epidemiology is one, statistics is one, biomedical sciences is one, environmental health sciences, social and behavioral science, health policy and management are other disciplines that fall under public health. We talked about epidemiology in another video, but just briefly, epidemiology is the basic science of public health. When you're thinking about the study of epidemics, they focus on human populations, usually starting with an outbreak of a disease in a community. It aims to control the spread of infectious disease, and it seeks causes of chronic diseases and ways to limit harmful exposure. Again, so think about COVID-19, and the focus, how epidemiology would focus on human populations related to COVID-19 populations, meaning gender, age, vulnerable populations. Um, and you want to understand at the outbreak of COVID-19, starting from the outbreak, how these populations were impacted. It would also focus on how to control the spread of the infectious disease. So think about how epidemiology, the role and function of this area, this discipline of public health, how it would work to control the spread of infectious disease, and what are some of the interventions that you know of that we put in place to control the spread. Seeks causes of chronic diseases and ways to limit harmful exposures. Again, think specifically about COVID-19 for now and ways that we have tried to limit harmful exposures, but also think broadly about other type of chronic conditions and ways to reduce people's exposure to those. Think about cancer and smoking. Think about um, overeating and obesity, and or exercise and obesity, for example. Epidemiologists are mainstays of local public health departments. It's very important that you know that most of your public health departments will be very heavily um, um, have a very heavy function related to epidemiology. So most of your health departments, think of the CDC, think of the National Institute of Health, think about government, think about state health departments. You'll find a slew of epidemiologists there, as a key center for in terms of function for public health. Statistics is also an important discipline. The government collects health data on the population and usually conveys this health data through statistics. These numbers are diagnostic tools for the health of the community. The science of statistics is used to calculate risk and benefits to a given society or given population. Statistical analysis is an integral part of any epidemiological study seeking the cause of a disease. So we use statistical analysis to understand the causes of disease. We also use a statistical analysis, big data, as an integral part of any clinical study testing the effectiveness of a new drug. And so you'll see statistics often. In some of our courses here at Howard University, you will be exposed to statistics, um, as because it's an important function not only just for public health but for social sciences as well. Also, when you're thinking about statistics, we also have courses in which we educate you on, train you on how to do community assessments and how to seek information through census information, labor department information, Department of Health and Human Services, You will be learning that in your work here at Howard University. Similarly, you'll also be using that work gathering data for other courses, and perhaps even in your field placement, you'll be expected to gather some statistical information about the populations that you're serving in your field and or the community in which um, uh, that 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 field agency is located. And you may also do some statistical data gathering for the agency itself. So statistics is really key. It's one of the scientific methods that we use, statistical analysis and analysis of big data to understand not only population health, we also use it to understand trends in health too, using that data. Biomedical sciences um, focuses on infectious diseases, and it understands that infectious diseases are pathogens. Biomedical science also tries to control infectious disease as a major health focus in general, but specifically earlier on in the United States history. I talked about how we, in our um, um, earlier U.S. history, infectious disease was major, plagues and flus, fevers, scarlet fever. Those type of infectious diseases were known to devastate populations, eliminate a percentage of the population. And so we know that those type of infectious disease and pathogens were huge. And so biomedical scientists works focuses on that particular area in hopes of trying to reduce that. I think COVID-19 is probably one of the more most is the most recent infectious disease that we have had to deal with in a long time. To the extent that it is a pandemic, and we talk about COVID-19 specifically as being unprecedented. I think it's unprecedented in our most recent history. But if you check the U.S. history, and if you remember your grade school, your high school history lessons, we don't talk about it much, but it is not unprecedented to have this type of this type of disease that are oftentimes were brought in out of the country from people traveling to and from. But biomedical research is important to understand the controlling of new diseases and non-infectious disease as well. So biomedical scientists focus on chronic disease as well as genetics and the role that genetics plays in diseases. Environmental health science, a classic component of public health. Much of the public health improvement in the U.S. in the 20th century was due to improved environmental health. Health is affected by exposure to environmental factors such as air quality, water quality, solid and hazardous waste, safe food and drugs, global environmental change, etc. One of the examples provided in earlier videos was the Flint, Michigan, Flint, Michigan water crisis. Thousands of new chemicals enter the environment every year, and we have to understand the roles on those chemicals in affecting or affecting public health um, for populations. There are a lot of concerns that a lot of food and drug um, um, standards um, put population health at risk. There are a lot of concerns that a lot of medicines and foods and things that are in the foods that we eat may cause cancer and other type of public health challenges. Also, environment, air quality, water. Think about industries. Think about corporations, companies that emit certain fumes in the air. And so there's also concerns about how that impacts overall public health. Also, global environmental change. One of the things that we focus on, I think, currently is global warming and how that may impact the overall changes that we see um, in population health. And even though we're talking specifically about global environmental change, there's also concerns about how the global environment impacts living organisms, plants, animals, bugs, And that also can cause public health concerns as well in terms of um, the health of plants and animals, again, because it's all part of our ecosystem. Social and behavioral science. Behavior is now the leading concern of factors that affect people's health. We know that people's health behaviors have a direct impact on their overall health, and so impacts population health. A theory of health behavior is that social environment affects people's behavior. Major health threats are tobacco, poor diet, and physical inactivity and injuries. We know that blacks have a lower overall life expectancy than whites, even when incomes are similar. We also know that there are other ethnic minority groups who are also at increased risk for a variety of health problems as well. We also use a lot of theories of health behaviors to help us understand how people view health conditions, health issues, which impacts how they address it. One of them is the health belief model. We'll be talking a little bit more about theories of health behavior later on in the course, but it's good for you to understand those health theory behaviors or those health behavior theories because they really they help you as practitioners understand how people why the trends in healthcare is what they are, or why the trends in public health when it comes to disease and illness is what is how it develops. It gives you a lens of understanding why people's behavior related to healthcare access, healthcare testing, healthcare treatment, healthcare intervention may be what it is. Health policy and management or health administration. This area of study examines the role of medical care in public health. It also examines the cost of medical care in the U.S. We do know that the cost of medical care is out of control, and the U.S. has a higher percentage of populations without health insurance. We know that people often lack access to medical care. Um, we can say today that the Affordable Care Act or Obamacare has increased the amount of populations with insurance. But we also know that insurance is just one factor in population health in terms of, um, we know that insurance impacts health behaviors to a certain extent. But we also know that there are people who have insurance that often times continue to not access health services. So we know that even though it provides some explanation, not a comprehensive understanding of health behaviors. Quality of medical care can be measured and is often questionable. Medical care has eaten up profits that could be used more beneficially for education, housing, and the environment. The thought here is that we spend a lot of money as a country treating illness, treating ailments, treating disease and conditions after the fact. And there are many models and beliefs that feel that primary prevention um, is a lot more economically feasible to spend money on social determinants of health so that if we deal with those social determinants such as education, housing, and environment, that will improve overall population health to where you won't have to treat or spend money to treat diseases that is more costly than to prevent. Public health prevention and intervention. Primary prevention prevents an illness or injury from occurring at all. We talked about that in the earlier video. Secondary prevention minimizes the severity of the disease or injury once it has occurred. Tertiary prevention minimizes disability by providing medical care and rehabilitation services. We also we want to have a firm understanding of what the public health approach is. So the public health approach defines the problems, identify risk factors associated with the problem, develop and test community level interventions to control or prevent the cause of the problem, implement interventions to improve the health of the population, and monitor interventions to assess their effectiveness. We also use root cause analysis or chain of causation. Chain of causation involves understanding the agent, the host, and the environment. It is known as a traditional approach to dealing with infectious disease. And interventions can focus on any of these targets. And this model can also be used for other kinds of illness or injuries. Please be sure to read more on the chain of causation and understand it as it is a traditional approach to dealing with illnesses, infectious disease, and injuries. Public health and terrorism. We also know that there's a connection between public health and terrorists. For example, events of 9/11 and the anthrax letter highlight the importance of public health. We also know that public health response to disasters, natural and man-made, helps to control the damage and to prevent further harm to survivors and rescuers. We also know that public health response to 9/11 was essentially the same as needed for other disasters, such as factory explosions and plane crashes. We also know that bioterrorism is recognized primarily through classic public health measures, similar to those used for natural epidemics. The threat of bioterrorism did more to teach the public about public health than any educational program. Please be mindful when we approach 9/11, if you have time, watch some documentaries, learn a little bit more. Or I know you, if you already are familiar with it, um, I want you to think about or reflect on, refresh your understanding of the events that occurred, but also consider um, how the functions of public health applied to 9/11. What were some of the outcomes of 9/11? What were some of the responses? Um, and how do that type of man-made disaster and the damage that comes from it, how did that put people at risk from a public health standpoint? Um, not just for people who lived in New York City at the time, in terms of people, if you remember, in the office buildings and workers, but there were a lot of public health backlash that occurred related to the first responders. They had a lot of challenges with healthcare was compromised during 9/11. One example was the toxic dust that came from a lot of the buildings, and how a lot of the buildings are made up, especially depending on the age of the building, have a lot of um, um, chemicals and elements that make up the building that, when they crash, emitted toxic dust in the air. And a lot of the first responders who were exposed to that dust day in and day out every day, helping with the rescue and cleanup efforts, suffered all type of lung and respiratory conditions, and some even high levels of cancer. They actually developed a victims compensation fund. It's called the 9/11 Victims um, Fund, to help those first responders get the health care that they need, and to help improve their health outcomes related to that exposure. And so again, that's just one example of a public health uh, challenge that occurred due to a man-made terroristic or man-made terrorism. And it also is a good example of a policy development response, a public health policy response to help improve outcomes. So again, there were a lot of people, particularly first responders, who developed cancer after that. And so, because of our understanding of that, and their exposure to toxic dust as being the source, public health, understanding that through the lens of public health, that a cancer compensation fund specifically was developed for 9/11 first responders. So some reflection questions for this chapter, or some things to think about. Describe actions that government have taken to ensure that people are safe and healthier today than people were 100 years ago. What are the three core functions of public health? We talked about this a couple times. How do these functions compare with functions of medical care? So again, you want to reflect on the difference between public health and medical care. And how are the six disciplines of public health used to accomplish the core functions of public health? We talked about the umbrella disciplines that fall under public health. And if you need to refresh, oops, here are the disciplines. Think about how epidemiology, how statistics, how biomedical sciences, how environmental health sciences, how social and behavioral sciences, and how health policy and management serve as functions for public health. Identify a health problem in your community. Reflect specifically on COVID-19. What are some of the risk factors associated with COVID-19? And suggest a possible intervention that the community could take to ameliorate the problem, or to at least help ameliorate the problem. Discussion questions. Here are some websites. Visit the website for American Public Health Association, the APHA. Read the highlights from the current issue of the American Journal of Public Health. Which of the public health sciences does each of these articles belong to? This is a good reflection exercise to help engage with the content for this week. So go to the APHA website, which is www.apha.org. Look at the American Journal of Public Health. That's their specific journal that they have that they publish. Go and look at the highlight of the current issues. The highlights give you the title of the articles that are in that issue. Just in reviewing the titles, and sometimes they'll list the abstract. So the title and abstract, understanding what titles and what type of um, articles or what issues, health issues that they're covering, specifically public health issues that they're covering in that journal, decide which public health science does each of the article belong to. Again, I went back, think about statistics, think about biomedical science, think about all uh, the disciplines under public health that I showed you on the prior slide, and think about how those articles fit within those six disciplines. Also, visit the website for the Nation's Health, the official newspaper of the APHA. This is the website for that. Read the headlines of the current issues to get an idea of the range of topics encompassed by the field of public health. I strongly encourage you to do this exercise in week one, or if you have time, do it in week two. This will help further your understanding of public health function, and it's a good segue into to help set the foundation for the rest of the content area that you'll be covering in this course. I hope this video was helpful for you. Thank you.